Hello and welcome to another segment of Western Wisconsin Journal. I'm Jamie Johnson, the legal and government correspondent. And today our guest is Senator Patty Schachtner. Senator Schachtner, welcome to the show.
Thanks for having me, Jamie. It's a whole new experience now, isn't it?
Yes, this is a second or third Zoom interview we've done. We've done some mayoral debates by Zoom and so forth. And by the way, you don't mind if I just call you Patty?
That's totally fine. That's who I am. I'm Patty.
All right, Patty. Well, great background there. You got the family name and family pics, I'm assuming. So, yes, we've been operating out of the home quite a bit. I happened to be at my conference room at my work today because I had a couple other things that I had to do. But we're in that, 7-8 weeks now that we've been in the stay-at-home, under the stay-at-home order. And we wanted to have you on before the official campaign season starts to just talk about where we're at from state government level. We've got some directives from the federal government, but they're not so much directives as they are guidelines. And President's been very clear that he's leaving it up to the states for a lot of this. So the three main areas I wanted to talk about, I think we'll spend a lot of time on testing. And then to the degree you can, prognostication regarding any kind of budget repair bill for this fall, and then touch on what voting might look like in November. So let's start with, the return to normalcy, and we have yet to determine what normalcy will be. But a lot of people are pointing to the testing, and we've got the states saying they didn't have the resources for that. We had states competing to get testing kits against other states, and one state like Maryland had to, go out to South Korea to get stuff. So we haven't seen a lot of coordination from the federal government in that regard. But as recently as this last week or so, we did have some drive-up testing going on. So we've advanced in the last 8 weeks, because 8 weeks ago I had some flu-like symptoms and asked to be tested, but they refused because I didn't have enough symptoms and I wasn't in the right age group. So where are we at with testing currently, and how did that go last week?
So last Friday and Saturday, they had the testing for, there was multiple places in Northwest Wisconsin. I know about the results of the ones that happened in Baldwin and River Falls. So we had 149 tests, I believe it was. Let me just clarify. We had 185 tests in River Falls and 229 tests in Baldwin. And from the last I heard, there was 4 positives out of those. So that was good news to know that we had all these people that came in, got tested, and what the results are. So that helps us, when people start doing their work and their contact tracing to see where this is all going. I also know that the nursing homes are going to start doing testing of residents and staff. So that'll also be good, because that's where the highest population is of people who have the lethal ramifications of this virus.
Right. Now, if I can stop you there, Patty. First of all, so on these drive-by testing that were occurring, and you roughly 400 tests between the River Falls and Baldwin testing. And you mentioned 4 positives. There also are some probables out of there that still need some follow-up.
Yeah, all the results are not back yet. So, when you get the test, then you also go through a questionnaire. So there are people who were tested that could potentially be probable, but the results aren't back yet.
All right, Patty, just before we had your mailman come to your door, we were talking about the testing, and you were also explaining that now this testing that was voluntary, and it was folks who were inquiring. We don't have the breakdown as to who was symptomatic and who was not, and of the positives, the 4 positives, how many were symptomatic and how many were not. But this is all part of what public health information they're trying to gather. Now, you're looking at the trouble areas, which have been the long-term care facilities. That's a nationwide issue, and because that's the most vulnerable population. And also meat packing plants. Now, I don't know that we have any meat packing plants in your district, but starting with the long-term care, is this something that is a requirement of the state? Because I saw that there was talk of that actually being required if they want to keep their license, that they have to test their staff and their residents.
Well, I think, with public health, everybody's working together. There are some standards that have been set up in DHS for the nursing homes. So I would imagine that there will be some requirements, but I'm not familiar with all the requirements, what that looks like. But I do know that our facilities are starting to work with testing agencies to figure out how they're going to, number one, get it done, get the testing done. What does it look like? And how do you set up your facility? Because again, you're testing both your staff and your residents. And, let's say you have the testing goes through and it comes back and you have one or two staff members that are asymptomatic. Well, what does that look like? So then do they, are they in isolation or are they in quarantine, and how many days, and what is the follow-up and all that? So, the testing part is the first step, and then what's going to happen once the tests come back, and how do they facilitate that, and then also keep their business running up to speed. It's not like we have copious amounts of nurses and CNAs to backfill if a staff would come back testing positive and asymptomatic. So, as we start, ramping this up, there are going to be there's going to be little things and I think the governor has put it really well in dial backs. It's not a flip the switch on or off. It's really more like a dimmer switch, and okay, we did this, now we got to do this, and trying to figure out how we adapt to this. I think that it's going to be interesting as we move forward and really start working on these facilities in long-term healthcare, and then you have memory care and you have assisted living and all this. How is it that this is going to look, and what are we going to do when you have a population that you're serving and a population that's working, and they're both being tested, and how does that impact that facility? So I think we're on page one of this journey and testing of our facilities, but I think there's going to be a lot of coming back to the table and going, okay, this here happened. Now let's look at the algorithm and how we can best serve not only our employees but our primary consumers, which are the residents that are there. They're there and we're taking care of them, and we have to make sure that they stay safe. And out of everybody who has been isolated, they have been isolated the most during this 7 weeks. My dad is in a nursing home in Hammond, and it was a couple weeks before the actual shelter at home even happened that the lockdowns really became proficient. So I've seen him through a window, but I haven't physically seen or touched him in months, and how are we going to adapt to that? And can we keep this up? And do we want to keep it up? And if a facility tests and everyone comes back negative, do you open it up and say, come on in? What do you do? So, there's a lot of questions that are going to be asked, and there's going to be a lot of push and pull in trying to figure out how we're going to navigate through this as we move forward, and try to figure out how we're going to live with this virus, not only as a society, but in these societies that have, condensed population that are vulnerable.
Right. Well, that's speaking about testing of populations that are vulnerable. The ones who are less vulnerable would be younger folks, although there's been some that have been seriously ill from this. It doesn't seem to affect those that are in that school age category as much. And what are you hearing from, whether it's the Department of Public Instruction or whatever, that where we might be with our schools? I'm assuming it's going to be first have to be something where the state gives permission. It's not going to be up to individual school boards whether to open up their buildings or not. But then once the permission is granted, that it could be up to school boards whether they want to, in what manner they open it. And are we going to go to restrictions on size? Is it only, school districts that have small populations that can go back into their buildings, or do the larger schools like Hudson have to go to every other day or half day instruction every other day and so forth? And then what kind of testing would be going on there? I mean, it's one thing to test the senior citizens who are in the nursing home, the long-term care facilities, and the memory care and so forth. But what about the tens of thousands of students, and how frequently do you test, and so forth there? And will there be mask requirements, and a lot of more questions? But where do you see the schools being, let's say, come September?
Mm-hmm. Well, I think this is going to be another one of those ongoing conversations. There's a lot of things being, looked at from private and public schools and our universities and daycares and all. How is this going to look as we move forward? And it's on paper, it can be easy to say we're just going to do social distancing, lunch is going to be served in the classroom, but there's a whole lot of obstacles that come with that, food service and equipment that you have to buy, that you're going from, classroom to classroom, serving lunches. And I mean, there's a lot of things that are going to have to be adapted to meet those needs. And, is it going to be an every other, or is it going to be, in a hybrid? Our local school district's going to, be able to have conversations, school boards can't even meet yet in that. So to have those really good conversations and have, input from parents and teachers and, and students, what are students' expectations? So thank goodness we're close to the end of the year. We have, a couple months that we can actually look and see how this is going to play out in the fall. But when it comes to testing for kids, we're already seeing that kids that have the new phenomenons that are coming up with symptoms kind of like Kawasaki's disease, there are some complications that are showing with children. So I think as we move into the fall, the biggest burden to me that school districts are going to have is, are they providing a safe environment for students, and do parents trust that the school districts are providing a safe environment? And what does that look like? Just the cleaning aspect. You take a computer lab, bringing in facilities to come in and clean after every class. That's going to be a huge challenge, because our school districts don't have that many facilities, people to be able to do that. Now take a school district Hudson size. How many computer labs are there? How are you going to do that? How, what does that look like? So I think, as we start opening up and as we start thinking about education, the primary thing that parents are going to be looking at is my school district providing a safe environment for my child, and what are the policies and procedures that are set up? Are you going to be doing temperature checks when everyone walks in the door? That could be a requirement. Well, how does that look? Are you going to have kids lined up outside waiting to come in, to get into the school if you're going to do temperature checks? What does that flow look like? Are you going to stagger the buses? It's all very interesting on how this is going to work, and all these are things that before they even get into the classroom. And then when they get into the classroom, then, how does the education piece look to it? And, is there going to be desk sharing? So if you do social distancing, does a student have the same desk all the time, but are they sharing desks? Are they sharing books? So every other day, and the cleaning with that. There's so many questions that are going to be had, and right now we're just kind of hanging on by our fingertips, getting through homeschooling our kids and getting through this. But there's going to be a lot of questions next fall that pertains to children's safety, and it's against an invisible thing. It's a virus. You can't see it. So we have to figure out at the state level guidelines on what safe schools and safe classrooms look like, and then really talk to school boards and figure out what is doable, what is workable, how does this look, how are we going to track it? I mean, there's just a lot. There are businesses right now that temperature check their employees every day. So, if that's what the future looks like, how are we going to do that for the thousands and thousands and thousands of children that we need to educate in this state? And, and what's the cost with it?
Well, and on that last point, what's the cost of it is my next question, because we've seen protests even in Madison, in other states where, armed people with, have gone into capitals and engaged the state police and so forth, and protesting, saying we need to go back to normal and so forth. Part of this is their point is just not worth it with the few. If we know that 95% of the deaths are people that are in the vulnerable population, if we just isolate them, let the other 95% of the people then go back to normal. But, there's a cost, they're saying, to the economy. And when does it become worth it to cost, 20 million some jobs that have been lost, and approaching 30% unemployment in some areas? And is that worth it to do all of this safe, making safe for people who are really not that vulnerable in the first place? But in the terms of the cost, all that testing, temperature checks, it costs money. And who's going to pay for this? The federal government has, set up funds for large business, small business, and direct mailing of checks. But I haven't seen anything yet that's going to be specifically helping state governments. And on that point of state government budgets, in April last month, the state of Wisconsin took in $850 million less than it had a year ago at this time. You do that over 12 months, you can't sustain that. That's over $10 billion a year deficit. So are we going to have to raise the property taxes to pay for all these extra custodians we need in the schools, and the extra testing and all of the extra procedures? Or is it just not worth it? We just continue to do virtual learning. So I was just curious, what are you forecasting, given we've had quite a partisan atmosphere in Madison? Do you see them coming together on some type of budget repair bill to be able to, we're not even into this biennium yet, and we're already running huge deficits?
So that's a good question. Back in March, we signed on really to really provide state funding for food banks and food delivery programs to ensure coverage for the diagnosis, treatment, prescriptions, and vaccines related to COVID-19. It also included support to county and municipal governments for emergency assistance, hazard pay for childcare providers, and help cover the cost of healthcare providers' childcare. Also supporting EMS and law enforcement should they get COVID-19 on the front line. And then also expanding programs to support our small businesses and farmers. And then the real big one really was further broadband expansion. This here this virus has showed us that some businesses had to adapt to the 21st century real quick. And as a state, when we're talking about inequities, broadband is a huge, huge problem. And we have to be able to, look at Wisconsin in the 21st century and go, what does it look like? We're already finding out that people can work from home and it's doable, but you need to have broadband. Children can learn from home. It's doable, but you need to have broadband. Medicine, you can have a doctor's appointment from home, but you need broadband. So these are all conversations we've already had, and we haven't been able to vote on that, and we're going to have to. And the only difference is now there is an expectation because we've seen that it can work. We can, not all of us, but a lot of people can work from home, and it's changed the whole dynamics of what workplaces are. So I think businesses, especially corporate America, is going to be looking at not having big office spaces and actually utilizing working from home a lot more. And if your state does not have good broadband, that's going to be a big obstacle for employers and employees moving forward. So broadband is a huge piece to the success of Wisconsin as we move forward, if we want to move into the 21st century. And I think that there is opportunity for all of us to work together and do the greater good for Wisconsin. I'm hopeful that we will have some session days that we can and really sit down and talk about all this here stuff. We're not there right now. I'm eager to go and figure it out anytime, but we need everybody to be on the same page that for the greater good of Wisconsin, these are things we need. How we get there, there's a lot of processes that we can streamline. I think, as we look at our local governments, our local school boards, our county boards, our town boards, our village boards, we're all told as department heads that to look at our budgets and figure out a process to streamline. We're all doing it locally, and we need to do that also statewide. How do we streamline processes? What do we need to do to make sure our processes are working for the best of the 21st century? Anybody with just an ounce of business acumen really knows that processes and streamlining processes is where the money is saved. So we can do it if we have an appetite to do it. And I look forward to some really robust conversations on how we can really streamline processes at each level of government to really showcase that we can get work done together and do it in a fiscally responsible way also.
You mentioned that hopefully we'll be able to have that time where the legislature comes together. Right now, though, nothing is scheduled. And we've got this election coming up in November, which historically, the closer you get to November, the likelihood that any legislation will pass is even less. And you mentioned about coming together. So do you hold hope? What percentage chance do you give that something productive is going to happen from either the Assembly or the Senate?
I am always a glass half full, so I'm always hopeful that we will come together with solutions for the people of Wisconsin and really work for them. We work for them. They don't work for us. We are supposed to be bringing solutions and bringing opportunities to our local governments and all the way up to the state, and then take guidance from the federal. It is up to us to work in between there. So I'm always hopeful that we will come together and really do some real problem solving. Folks have had to do some real serious problem solving on their own for the last 7-8 weeks through the shelter at home. And no matter how it looks, from someone who works on the front line and has worked in emergency preparedness for a long time, the fact that nothing happened, we know when nothing happens that we did our job and we did it well. So yes, I understand that people are frustrated, but we accomplished the goals that we wanted. And I am so pleased with that. And I will continue to fight that fight. We did, and what was accomplished was what we wanted. That was the goal. So now as we move forward, now we have to figure out what are we going to do when that isn't there. What do workplaces look like? What do stores look like? What's the experience at a restaurant going to look like? Opening up isn't going to miraculously get everybody back into storefronts and restaurants, because you have to feel safe. And, the last survey by Marquette, I just want to make sure I get the right numbers here, 63% of Wisconsinites still agree that it's appropriate to have the schools closed and businesses closed. And over 80% of Wisconsinites are still concerned about the pandemic. And with that, 56% of people are more concerned about reopening too soon or not soon enough. So, and 73% of Wisconsinites say they would be uncomfortable attending sporting events or concerts. So as we move into the summertime, people are not comfortable with large groups. And as a community and an area, D10 is primarily, some of our biggest dollars comes from tourism. So if the people aren't comfortable, and we're talking about people with disposable income. So, you think about, you have a third of people that are going to go back no matter what, that they're not afraid, they're in the right demographic. Then you got a third of people that are going to sit back and just wait, see how things play out, shake out. You had a nice backyard, you've updated your outdoor space, and you're totally happy just having, your close circle. And then there's that final third. That final third is the ones with the most disposable income. They're the age break of 55 to 75. They have the most disposable income to spend. They have adult children and they have grandchildren. Are they going to risk the relationships with their adult children and grandchildren to go out in public versus staying home so that they can have those people closest to them near them? Those are the people that we have to make sure that they feel safe, because they're the ones that have kept our disposable income economy going, and especially in this in a tourism-based economy. So for our downtowns and areas to really, have a robust comeback, we have to make sure that all our businesses have all the tools supplied to them, and all the information supplied to them to provide what a safe environment looks like. So those people with the disposable income feel safe to come back and experience what you have to experience. And if there's nothing changed, what message does that say to a consumer?
Right. No, it's a very good point. Now, along that point of reopening, you're talking about what it looks like and trying to stimulate the economy because of some gradual return to normalcy. In Wisconsin, you could draw a line from Green Bay down to Dubuque, Iowa, which is in the southwest corner of Wisconsin. And everything to the south of that line, south and east, is where about 98 or 99% of the hospitalizations are occurring, and only 1 or 2% above that line. And that would include your 10th Senate district, where there's hardly any cases. There's plenty of hospital capacity. There's very few ICU beds dedicated to anybody with COVID-19. What do you think the chances of having some type of regional return that takes into account those disparities in numbers of cases and severity of cases? I saw where the governor said he's open to it, but he put it on the Republicans. You come up with a plan and tell me what you mean by regional reopening. Have you been asked to serve on anything like that, because you've got some knowledge of what's going on here in Northwest?
No, I have not. But yeah, the regional question is a really good question. And so Joe and I, my husband, were out on a motorcycle ride, because that's what we like to do. And we were going around, we like to go around the lakes and whatnot in the area. And so when we talk about regionalization, what does regionalization mean? Does it mean traveling from Polk County to St. Croix County, from St. Croix County to Burnett County? Or does it mean regionalization from state to state? When we will go around lakes and drive the back roads of every place that's going on, and the license plates aren't from Wisconsin. They're from Illinois, they're from Minnesota. We've even seen them from California, and New York. So there's a lot of people that have property in our region that will be traveling here, and we don't keep track of any of that. So it could inadvertently, the virus could make its way here without local people even knowing, and the people could be here and gone before it even shows up. So those are the things that we have to worry about. So regionalization as a concept is good. It's probably worth thinking about, but what does it look like? And if someone comes here from not the region, are they quarantined to that campsite for 2 weeks? Are they quarantined to that? No, that's not reasonable. So when we talk about regionalization, we have to take all the businesses that we're discussing, and then what does regionalization look like, and who's responsible for that? Who's going to enforce that? I mean, it seems to me that is unreasonable to think that people are going to be doing license plate checks on who's coming, from where. So then, on concept, regionalization could happen, but if we do that, then we need to prepare for what the reasonable outcomes could be. And, yes, we haven't had an abundance of people in our hospitals with COVID, and we haven't had a lot of that there go on. But that doesn't mean it can't happen. And to me, the even bigger question would be, okay, we open it up and we have a car accident and a COVID patient at the same time in the same ER. What are we going to do about that? Right now we don't have that happening. In St. Croix County, I just did a thing for public protection for the medical examiner's office last week. And in 2019, from January to May 1st, we had 3 suicides and 11 accidental deaths and 22 autopsies. In 2020, from January 1st to May 1st, we had 3 suicides, 1 accidental death, and 9 autopsies. So behaviors is going to guide the future, and our ERs right now are not seeing trauma. That's just not seeing it. And our law enforcement isn't seeing trauma. Our EMS is not seeing trauma. What we're seeing is domestic violence and mental health and addiction stuff, but we were seeing that before, and we hadn't had an investment in that. All it's doing now is showcasing that domestic violence, mental health, and addiction is a real problem here. And now, like you had said, with $800 million less in revenue, what are we going to do about it? And can we do anything about it? And what's reasonable in addressing that? So this here virus has really showcased a lot of the cracks that we have in our systems, and how we figure out how we're going to deal with it as we move forward is really going to be about collaboration and public-private partnerships. That's what it's going to be about. It's not going to be about partisanship. If it's going to be about partisanship, then we're not going to have some positive solutions.
Okay. Now, final topic is with we made allusion to the November election. We just came out of 2 elections here in the 7th Congressional District. One was the statewide election for the Supreme Court, and we all know the story about how there was an attempt to get the legislature to go to more mail-in voting. They refused, and the governor tried to postpone the election, and the legislature again refused and ended up taking it to court. And the day before the election, the Supreme Court said, no, it's going to happen on this day. And by the way, they have to be postmarked by a certain date and so forth. So that's because we had a very short time frame. Then nothing was done about the 7th CD. That was just election as usual. And no, but what are the chances that this gets looked at going into November, given that we do have almost 6 months left? We're now under 6 months. Can there be some better planning to go to ballot by mail, which several states have successfully adopted, and to keep everyone safe and keep them out of the long lines?
So that's a good question. Right now, I mean, it's not even a topic that's being discussed at the state level. I would anticipate that elections are going to be run just like they were in the past 2 elections. It's really going to work. People have to be motivated to sign up and get their ballots sent to them. And I don't care if you're independent, Republican, or Democrat, you have to reach out to people and figure out how to get to them to really start now to get your ballots to you ahead of time. Again, what this is going to look like, we have a primary in August, and then we have the big election in November. What this is going to look like is anybody's guess. When you look at the election yesterday, turnout was really, really low. You start going through the numbers, and it was really low. And we have to all really figure out how we're going to connect with people in the 21st century and get people to vote, and get them to vote and feel safe about doing it. You should not feel unsafe. And when you think about November, I mean, we could have a snowstorm going on. it could there's anything that could be going on that day. And in rural Wisconsin, none of us have the capacity to have a long line of people standing outside during a snowstorm, and our presidentials are really big elections. So I would imagine that there's going to be high turnout. And I would also imagine that there's probably going to be lots and lots of people that are going to be demanding and requesting early voting and absentee voting. So there's a lot of education that has to be done between now and then. And I think we can do it. We got our signatures in 3 weeks. We had over 1,300 people sign our papers. So I'm confident that people are engaged. We just got to figure out how to reach out to them and get them inspired to get their early ballots.
But if you don't have automatic mailing of ballots to folks and make them request it, how are you going to fix what happened in April with over 100,000 people statewide that requested absentee ballots and just never got them?
That's a good question. And I think the only way that you can really do that is to have people really work on programs to get your ballots way before, start requesting earlier and not, 2 weeks before the election. As human beings, we are procrastinators. We know we need to do this, but we wait till the last minute to do it. So we have to, we have to take onus ourselves as voters, that we have to do it. It's not up to everybody else to do it for us. We have to request it. We have to make those decisions. And, I always say, as long as you, vote, you have a say in all this here. But if you don't take the time to request your ballot or go vote, then, that's part of the problem. You have to take the time to do it. And we are Americans, and this is our right. And this is one of the best things that we can do. And it's, you feel good about it, whether you win or lose. You got to be heard. And I think that's the part that we all have to remember. It's our responsibility to make those requests, do it early. And if it's not coming in, find out why, and follow up. We can't always blame everybody else in the system for shortcomings when we know that, there's opportunities for errors.
Okay. Well, with that, I appreciate that comment. And I wanted to find out, how would people, if they have comments or questions or concerns about the reopening and about these public policy decisions that you've been talking about over um, this interview, how would they get their voice heard to you?
I always tell people, if you want to be heard, call my office, and we are there to serve you. Okay. Call us, let us know what's going on. It's 608-266-7745. And I have a wonderful staff. They are very, very efficient, and they answer all the questions. I can't guarantee you're going to get the answer that you want, but you will be heard. And I think nowadays that's the most important thing, is we have to be heard. We all have a voice in this, and nothing is going to be 100%, no matter what our expectations are. So we have to, call and engage, and, call and engage your assembly people too, So
that number again is 608-266?
7745.
All right, 7745. Well, Patty, thank you very much. We've been talking to Senator Patty Schachtner of the 10th Senate District, and she's at her home near Somerset, right?
Yes, I am. Sitting in the kitchen.
All right. Well, thank you for your time. And I want to thank our viewers for watching another segment of Western Wisconsin Journal, and wishing everyone to stay well and stay apart. And we'll get through this together.
Yes. Have a good day. Thanks, Jamie.
You too, Patty. And thank you for watching.